Shall we start, sir? Riyaz doctor, shall we start?
Yes, I am ready. Hello?
Yes, sir.
Hello?
Can we start, sir? Shall we start?
Ah. Am I audible?
Yes, sir.
Should I start?
We'll do the little bit introduction, sir.
Okay. Okay. You do introduction, then I will start.
Okay, sir.
Okay.
Good evening, everyone. Welcome to Rasa Siddhi, Wonder Rasa Drugs. Our faculty today is Dr. Ravishankar Parvaji. He has completed UG from SDM Ayurveda College, Udupi. He's done PG in Shalyatantra from the prestigious Banaras Hindu University. He has established a very good practice and developed so many innovative techniques in the field of anal diseases. I think perhaps he's the only one who manages acute stroke. And he serves as a guru for RAV students. He's presently consultant surgeon at Shushruta Ayurveda Hospital, Puttur in Karnataka. And so let's hope all this session is an eye opener for all of us. Sir, please continue, sir.
Okay, should I start now?
Yes, sir. You can start now.
Am I audible?
Yes, sir. You're audible.
Okay, thank you. First of all, I am thankful the organizers for giving this opportunity to share my experience of Rasaushadis in my practice. I am practicing here for last 32 years. Since I have studied at Udupi Ayurveda College, from my BMS days itself, we used to do practice many Rasaushadis in our practice. I have seen my professors practicing many Rasaushadis with wonderful result. And my starting my practice also, I have utilized many Rasaushadis. I will try to explain what is my experience with some of the Rasaushadis. First, let us pray God Dhanvantari. Om Namo Bhagavate Vasudevaya Dhanvantaraye Amrita Kalasha Hastaya Sarvamaya Nashanaya Trailokya Nathaya Vishnave Swaha. Then we go with the Guru Brahma, Guru Vishnu, Guru Deva Maheshwara, Guru Sakshat Parabrahma, Tasmai Shri Gurave Namaha. With the blessings of our all Gurus and Apurva Vidyas and Purva Vidyas, I will start to my presentation on Rasaushadis used in my practice. See, any Aushadhi, how it works, a food or any dravya, it works by Rasaguna Virya Vipaka. So this basic concept, since it is Rasaushadhi, we should not think it will not work through this Rasaguna Virya Vipaka. It will, any drug, it works according to Rasaguna Virya Vipaka only. So, how the Rasaushadhi makes more faster and pinpointed is actually the prabhava of rasa, parada. The presence of parada enhances availability of any drug in the target cells, target tissues. That is how what I felt. The Rasaushadis gives you very fast and effective results. But it works according to Rasaguna Virya only. We should not think, since we are using Rasaushadis, we should not see Rasaguna Virya but we have to see, otherwise it will not become a scientific understanding. So why scientific means I am not saying according to allopathic science. Science means according to Karya Karana Vivechana, on the basis of that is cause and effect Siddhanta. Any science means it should be working according to cause and effect Siddhanta. So rasas are 6, you see, as you all know, Maduram Lavana Katutirtha Kashaya. It is made up of Kshmambu, Agnikshmambu, Tejaha, Kavayu, Agnyanyala, Gonilehi. So according to this presence of Panchamabutas, or Tridoshas are made. Vipaka also Maduramla Katu Vipaka. Like that, Kapha, Pitta, Vata formed, and it's that Dravyas works on that particular doshas. And Virya again is Shita and Ushna. Even doshas are made up of have Shita and Ushna Viryas. According to that presence of Mahabhuta only, we will have Virya and Gunas also, according to presence of Panchamahabhuta. Permitting a combination of different Panchamahabhutas in different Dravyas, you will have 20 Gunas. So on the basis of this classical concept of Ayurveda, by Rasaguna Virya Vipaka only, all the drug works based on that the drugs work as Shamana, Kopana or Swasthaita. A Samana Guna Karma Dravya, it increases, Viruddha Guna Karma Dravya, it decreases. This is what we study, a basic principle we study from first year BMS itself. So this is the basic concept. So how works and why a drug works, as you all know. But some drugs works achintya karma by its prabhava. We cannot understand why it works, but only we will understand what it does. Then also we have to see doshas only, because which dosha increases or decreases, that is how it works. Because through doshas only all dhatu, mala, everything works in the body. Sharira is dosha dhatu mala moolam hi shariram. Sharira means it has all doshas, dhatu and mala. Its working pattern is done by three doshas only, everything. That is a Shakti Swarupi Dravyas. So we have to analyze this dosha in a given patient, then in given patient and given vyadhi. In a given patient you are seeing prakriti of the patient. In vyadhi we are seeing dosha, means that is a vikara prakriti, which dosha is involved in that particular dosha. That is why Charaka says Trivida Bodha should be there for a physician. That is, dosha you have to see, Samuthana Vishesh, how it occurrence occurs, and Sthana Samshaya, where the disease occurred. All three things we have to analyze in a very given patient, then we have to give the treatment. So that is why in a reasoning it is told for a disease, Kalartha Karmana Yogo Hinamichati Mantraka, either Ruddhi or Kshina, you will get a disease. By Ruddhi occurs Sanchaya, Ruddhi, Prakopa, Sthana Samshaya, Vyakta and Beda. Like that, as a Prakopita dosha, getting Sthana Samshaya in different places, you will have different vyadhis. Otherwise, three dosha means you will have only three vyadhis. You see, for example, in a given any vyadhi, if Shula is there, there is a Vata dosha. Or Shosha is there again. When Avarana dosha is there, there will be Shula. When Dhatuksha Vata is there, that is always Shosha will be there. In Pitta dosha, there will be always Daha, Paka, Kotha, Raktasrava. In a given vyadhi, if Kapha is involved, there will be Shota, Kleda, Kandu, Shitala, Gauravatva will be there. By this, different vyadhis occurs in the body. In that dictum, if we think that giving a treatment for doshas only, we think three dosha, only three medicines is sufficient. But actually, practically what happens, theoretically it may correct, but practically what happens, these three doshas, according to different sthana samshaya, it will present as a different vyadhis different signs and symptoms. So a treating physician with Swayam Dhiya in his own intelligence, he should, Uhana should be done by how and why, what happened in a given patient. You diagnose it. That is samprapti. Yatha dushtena rishena, yatha chanu visarpata, yatra sana samshaya. That particular points, if you understand in a given patient, then we should give a treatment. That is why Charaka says, Hetu sthana vishesha bhaved roga vishesha. According to Hetu vishesha also, there will be different diagnosis. According to sthana vishesha also, you will have different vyadhis like pakshakata, grudvasi, akshepaka, murcha, etc. Different vyadhis all over body, it may occur according to different sthana samshaya. That is why we need different aushadhis with the different combinations that we have to see. Otherwise, only single drug may sufficient. But practically, it is not possible with the single drugs we can treat. So, in a treating physician, that is why always he should analyze doshas in dushyam, desham, balam, kalam, madalam, prakrim, vaya, satyam, satyam, tatha, aharam, avastha, tatakvida. Sukshma pariksha. First, you do dosha nirupana, then aushadha nirupana should be done. Now, here I will discuss about 10 drugs. What I usually practice in my practice for last 30 years. Usually, we may use about 30 to 40 drugs. These are main drugs I use in my practice as a Rasaushadhis. Agnitundi, Ananda Bhairava Rasa, Arogyavardhini, Gandhaka Rasayana, Kamagag Mukta, Lagu Sutra Shekaravati, Mrityunjaya Rasa, Makaradhvaja, Sutra Shekar Rasa, Tapya Loha, Vasanta Kusumakar Rasa, Vata Gaja Ankusha Rasa, and some Gugulus. So Gugulu may not be, you think it may not be Rasaushadhi, but by its efficacy, we can consider these Gugulus also, that fastness of its efficacy. We can consider this also equal to a Rasaushadhis. So, first drug I utilize in my practice, that is Mrityunjaya Rasa. Why I am taking this as a first drug? See, all the vyadhis by occurs due to ama. Sarve rogya mandagna sutana utarani. All the vyadhi occur due to mandagni. When Agni Mandya is there, first production will be ama swarupa vata pitta kapha. That gets sana samshaya with the different disease. Each disease will have a sama vataja, sama kaphaja. We don't add word sama in every vyadhis. We tell vata pitta kapha. Vata jvara, pitta jvara, kapha jvara, like that. That means you should not think it is a nirama vata jvara. Always it is amayuktam jvara. Agni Mandya will be there. Not only in the jvara, tisara, Shwasa, Kasa, every vyadhis, there will be ama will be there. But only thing is, we are not our textual reference. They don't tell it is sama vata sama like that. It's by default we should understand it should be with dama only. That is why a sama vata in Arunadatta Tika he says sama vata there will be shula will be there. For sama pitta there will be daha and paka. Sama kapha there will be katinyata, sukti, all these symptoms, gauravtva, dhyana, vishyantata, this presentation will be there. So that is why we have to analyze the vyadhis. So we are taking different drugs. The first drug is Mrityunjaya Rasa. It contains Hingula, Vatsanava, Gandhaka, Maricha, Shuddha Tankana, Pippadi. So very interesting thing is, not only Mrityunjaya Rasa, like that many other drugs like for example Tribhuvan Kirti, Ananda Bhairava Rasa. Every drug contains Hingulam, Visham, Yosham, Tankanam, Nagarisham in the Tribhuvan Kirti. But its Bhavana is Surasardrakaya. Whereas in Mrityunjaya Rasa Bhavana is Gomutra. And Ananda Bhairava Rasa Bhavana is Jambira Swarasa. So according to different Bhavanas, this Rasaushadhi work differently. So usually we utilize this Mrityunjaya Rasa, especially in jvara or any amayukta condition. We should not think I will use it only in jvara. Jwara means is Namajasi. That is why in Namavata or Vatraka or in Pakshagata or Akshepaka or Kasa, Shwasa, everywhere Ama is there. For an Ama Pachana effect, I take Mrityunjaya Rasa as a first drug of choice. Especially, it is very effective in the Vata Srupam. And if Pitta Srupama, they just change its Anupana Dravya. Like that, if it is a Vatsarupama, we usually use Mrityunjaya Rasa with honey or with hot water, like that we give. Because already Gomutra Bhavana is there for this. Here I have not recorded Gomutra. Actually, a Vatsanabha should be soaked in Gomutra, then Shuddha should be done, then Gomutra Bhavana is given. That Gomutra should be Indian cow's Gomutra, not Jersey cow's Gomutra. So we utilize it. I have seen plenty of patients by utilizing this single drug, they get very fast result. Not only Jwara, if a patient of Amavata comes with severe pain, by utilizing Mrityunjaya Rasa, its pain and swelling is coming down. Or Shwasa or Kasa cases comes, utilize this Mrityunjaya Rasa. When its Ama Pachana occurs, they get relief very fast. Or in a headache, for example, some patient comes with after taking some food, they get headache. Just to give Mrityunjaya Rasa, one tablet, it's a 125 mg tablet. By that itself, they get result immediately within 2 hours. Their headache goes. Especially Ajiranaja or Amaja Shirashula, very wonderful drug when we can utilize this Mrityunjaya Rasa. So, like that, Ananda Bhairava Rasa is there. Specifically, this Ananda Bhairava Rasa we utilize in Atisara, whereas Mrityunjaya Rasa utilize in Jwara. Both are very specific Amapachakas. Definitely in other conditions, Kasa, Shwasa, Grahani, or Apasmara, Vatavyadhi. Agnimandya. Wherever Agnimandya is there, we can utilize this drug. Not only Ananda Bhairava Rasa or Mrityunjaya Rasa. So another drug is Tribhuvana Kirti Rasa is there. That is also a wonderful drug. I have not mentioned here. We fairly utilize in some of the patients, specifically a Jwara, a Vata Kapha Jwara. In such conditions, Tribhuvana Kirti is better than this drug. We utilize it. For Vata Pitta Jwara, you usually use Ananda Bhairava Rasa. And Kevala Vata Jwara, Sanipata Jwara, utilize Mrityunjaya Rasa. Like that, according to dosha, presentation of dosha in a given Vyadhi, we change the drug. All the 3 drugs, Ananda Bhairava or Mrityunjaya Rasa and Tribhuvana Kirti, its content is almost the same. One, its Bhavana Dravya is slightly different. According to that, its action also differs. So that is why I am saying always we should see what are its contents, what is its Bhavana. Especially in the Rasavashadis, you have to see its Bhavana Dravyas. So like that, it works differently. Another thing is, these are our Khalvi Rasayanas. Usually they do what Anulomana properties more, whereas in Sindura, Rasa Sindura, etc., they are more Laghu, making more Laghu, utilize Sinduras, whereas Khalvi Rasayanas, Kupi Pakwa Rasayanas, Khalvi Rasayana we use for Anulomana. So these 2 differences are there. If Anulomana is needed, we utilize Khalvi Rasayanas, whereas Lagutva is needed in a given patient, we utilize Sinduras, Kupi Pakwa Rasayanas. Another frequently I utilize this drug, that is Agnitundi Vati. It is a fascinating drug. I think all Vaidyas should have this drug. See, its combination, just you analyze why we should analyze, then we utilize in our practices. You see, its combination is, again, Bharata Gandhaka is the same, Vatsana also same. Even in Mrityunjaya Rasa also almost 3/4 is there. Everything is there. Only extra drug is very important. This one is Vishamushti, Vishatinduka is 16 parts. Where these are one part, 16 parts is Kupilu is there. Kupilu is Tiktarasa, Rukshadravya and Namapachaka. And it is a Krimigna Dravya also. One of the wonder drug as a Krimigna. So, Bhavana is a Jambira Swarasa. The indications and textual indication told Agnimandya, Shula, Amatisara, Jirana, Alarka Visha. You see, Alarka Visha is very interesting thing. Daurbalya, Rudroga, and Sangrahani. So, where I utilize, I think I can't say. Almost all the diseases I utilize it, especially in Vata Vyadhis. Wherever Shula is there, Shula means Avaranajanya Vata or Amayukta Vata, there will be Shula. Then you can utilize this Agmitundivati. So, as an Amapachaka. Another thing is, this is excellent Shulahara. If a patient comes with severe pain, don't think it's only abdominal diseases. Even a knee joint pain comes, osteoarthritis, Sandhyastikata with the knee joint or ankle joint pain. When pain is there, in such condition, as a Shulahara, you can utilize this Agnitundi. I am utilizing it. It gives excellent result. Within 2 hours, 3 hours, patient gets start to get relief. Don't think 15 days needed. Within 3 hours, you start to get relief. It's a very wonder drug. Some other specific is what I am saying, how this drug works. Specifically when the Krimi is there. Not only Raktaja Krimi, in Raktaja Krimi also it's useful. Koshtaja Krimi is there, Malaja Krimi. Small babies comes with the Malaja Krimi. Even after giving this modern medicines or Krimi Kuthara, all the Ayurvedic drug or modern Mebendazole or Bendazole, patient comes repeatedly, if you give the drug, still they come with that worms, worm infestations. Just you give Agnitundivati. The small babies, you give it very small dosage, about 1/4 of Rakti, about 25 mg or half 65 mg, like that you give a small dose. Gives excellent result. Within 2 days, their Krimi, that pinworm irritation, it goes off. You should give about 15 days or 1 month, you give continuously. It does not have any harm. That's Jirana, Kriya, everything increases and baby becomes all right. Not only for, and another thing what I am saying is, in a post-operative infections, then also we can utilize this drug, Agnitundi. Another disease what I find out, whenever there is an appendicitis is there, if you give Agnitundi, immediately their pain comes down and appendicitis inflammation comes down. It's an excellent drug. Definitely we can utilize in your practice. Anyhow, if it is obstructive appendicitis, if gangrene is there, definitely you have to go for surgical excision, because Abhyantara Vidradi should be done surgical excision. But the patient comes to you before that stage, before attaining gangrene stage, before attaining abscess stage. The patient comes initial stage, just you give Agnitundi. Within 3 hours or 4 hours, their pain comes down. It's an excellent drug. Or a patient comes once, got treated with the Shamana Aushadhi or IV fluid and got relief. Then to avoid surgery, some patient comes to us. Can you avoid surgery in a cooling period? They comes to us in a chronic appendicitis cases. Just you give Agnitundi continuously for about 3 months or 6 months. Their appendicitis is gone. It will not recur. This is an excellent drug in such cases. That is why he says. Another condition is, he said, is Alarka Visha. It's a Visha in nervous system. So what I find out, wherever that is a spasm occurs, a spasmodic, any neurological disorders, we see Akshepaka or it's Pakshagata or Gridrasi. In these neurological disorders, if you utilize this Agnitundi, you get excellent result. If it is in Ama stage, you give Agnitundi with hot water, or Shunti Sarasa. If patient comes in Dhatukshaya state, you give same Agnitundi with milk. It's a Brahmana. And with the milk it is a Brahmana. With the hot water it is a Karshana. When Shula is there, with the Ama, give Agnitundi with the hot water or Shunti Rasa or any Arishta or Kashayas. If a patient comes in Dhatukshaya state, that is a degenerative muscles or these things, I give same drug with milk, their muscles volume will increase. Some patient comes to get heavy, a lean and thin person comes, I want to increase my weight. Give Agnitundi with milk. Because it is a very, very good Deepana Pachana Dravya. Whatever food you give, that get digested and absorbed into the body, well metabolized. Whole metabolism activity of the whole system is done by Agnitundi. So this is so in different stages, different places in my practice, I utilize this Agnitundi. From Shwasa Kasa, from headache, from Agnimandya, Ajirana, or if a patient comes with loose motion, Atisara, give same Agnitundi with the lemon juice. Once in 3 hours you give. It's Atisara stops. If it's a very good Krimigna. It is an Aragvada di Gana, Vishamushti is a drug. Aragvada di Gana is a very good Krimigna Dravya. Utilize it. Creamy means don't think only Malaja creamy. Creamy is Raktaja creamy also. Your infections also creamy only. Bacterial, viral, any infection, it comes under creamy only. You can utilize it. Only a thing what you should see is in a Pitta Prakriti patient, in a Pitta Pradhana Avastha, in such conditions, it may increase his Pitta. So, in such patients, you should be very careful when you utilize Agnitundi. Some patient comes with, after use as a side effect, in this drug, what we see is, in a Pitta Prakriti fellows, there will be blister, reddish blisters with the itching. Such patient may come. And then what you have to do, you should stop the drug, give him lemon juice slowly, and milk you give slowly, that blisters will go. That one side effect is there in this drug, especially for Pitta Prakriti fellows, very severe Pitta Pradhana Avastha Vyadis. In all other conditions, Vataja, Vata Kafaja, or Kapha Vittaja, when Kapha Pradhana. This condition, only Pitta Pradhana Avastha, Pittaja Vyadis, you should think twice before using it. So that is one thing is there. Even then, in a Pitta Prakriti fellows having a Kafaja Vyadi, then you can utilize it. But there is you should have this caution. There is a chances of blisters in the body. Itching and reddish blister. It is not a serious condition, very mild condition. When you stop it, this drug, within 4 days it will go off. So, especially another thing is when you use in Sharad Rutu or in Grishma Rutu, in such a time also when you utilize this drug, there is a chance of that blisters. Just you give in a smaller dose or lesser time. As soon as you get result, you can stop. This is another wonder drug what I utilize in my practice. So another very interesting drug is Arogyavardhini, Evati. You see, in this combination, you see it's all Rasavishadis, Parada, Gandhaka, Lovasma, Prakasma, Amravasma, Shilajitu is there, and Trifala, and about 4 parts Katuki, Chitra Mula, and 22 parts Katukarohini is there. Another combination, some company fellows, they utilize another combination of same Arogyavardhini. There are about, I think, 64 parts of Katuki is there. There, Katukarohini portion is more, and Bhasma portion is less. In some companies have Bhasma portion more, but Kashta Aushadhi Katukarohini portion is less. So whenever you use this drug, you have to see the combination, which combination they have done. Different companies do different combinations. Just for your information, I'm saying. And its bhavana is Nimba Patra Surasam. Specifically, he has done it in conditions of Kushta. It is as you all know, it is a category in its best Pitta Recha Dravya. Usually, everyone thinks is best Pitta. The very interesting thing is this drug is best Vata Kafara than Pitta Dravya. When a Pitta Prakriti fellow, a Pitta Pradhana Avastha is there. In such cases, his Ushnata of the body will increase with this drug. Why? Because Pitta is made up of Agni and Jala. Jaliyamsha Pitta goes off more, so that Agnayamsha in the body increases. So that is why, even though he said Vata, Pitta, Kapha, Jvara, Pachana, Deepana, Medu, Nashaka. That is why whenever Medu Vruddhi is there or Mala Bandha is there, in a Koshta, don't think it's only Koshta Jamala. In Dhatu Jamala, Dhatugata Mala also will be there. Even in a single cells also, Mala is accumulated in the body. If you feel like Mala is accumulated in the body, just you give this drug continuously. Just one bead is sufficient. Slowly his Mala portion of the body will decrease. He becomes Shodhana occurs. Just instead of giving Virechana treatment, you can give this drug for about 15 days, 20 days like that. Definitely his Mala this one Virechana occurs. Don't think severe Virechana occurs. One thing is Mala in the Dhatu Gata Mala and Sharira Jamala and Koshta Jamala also. Slowly wards off. You will become Shuddha. That you can see. Only thing is, in a Pitta Pradhana Avastha, you should be careful whenever using this drug. And Vataja Kafaja Avasti or Medu Dosha Vruddhi is there. Especially Medaja and Kafaja Vyadhis. Specifically, we are utilizing, I am utilizing more in Galagandas. Kafaja Galaganda or Vata Kafaja Galaganda. This is an excellent drug. Patient is TSH is 40-50. Definitely use this Arogyavardhini Vati continuously. Slowly his TSH level comes down. So it's a Karshana Tamra Basma is there. And Rudhya also by Abraka Basma is there. And in Kushta, of course, it is a excellent drug. So specifically, whenever Kapha Pradhana, Kapha Vittaja or Vata Kafaja, in such conditions, Kushtas, it works very well. Any Vyadhi, you have to see when you can utilize this drug. Whenever Kleda is more in the body, definitely Arogyavardhini works wonderfully. If a watery discharge is there, definitely you can utilize it. But burning is more. In such conditions, I think Arogyavardhini does not work like that. His burning may increase. That's what I have seen. In a Shureshula person, when he had redness in eyes and burning, Arogyavardhini is increased. But heaviness is there in the body. Definitely utilize Arogyavardhini. Shureshula with the heaviness. It may be Pitta Kafaja or in the conditions of Tvakroga. And he said since it is Jwara, it is best Amvachana. Wherever Ama is there, in a Amavata or Vatarakta, when Kapha Ama is more, utilize this Arogyavardhini, naturally it goes off. It is a wonder drug. Within some patients get relief within a week by utilizing Arogyavardhini. With the other drug, you can utilize Agnitundya and Arogyavardhini or Arogyavardhini and Mrutyunjaya Rasa. Like that combination also you can give. But give in smaller dosage. Don't give 2 TID, 3 TID. Just give 1 BD. 325 mg or 250 mg, 1 BD. That dosage is sufficient. It gives excellent result. No need of giving a big dosage. A small dosage with very less cost, you get a huge result. This is what you can attain with Rasaushadis. Instead of giving Tikta Kashayas for longer time, the small drugs with the small dosage, you get same result with the fast. What I feel is in the presence of Parada is a wonder drug. It increases or it activates the other drugs activity. Especially it work is done by Katugurohini and Chitrakamula and Nimba Patra, but its activity is increased by presence of Parada. We are thinking of Parada Kandaga Lovasma Brabasma. Its part is very less, 1 milligram, but that 1 milligram increases to 22 milligram Katugurohini's action. So wonderful Rasaushadhi works like that. It has so much what you were saying, its activities increases, 4-fold increase will be there. So what we see in our practice, I think Aragyavardhini, still now I had told Vataja and Vata Kaphaja condition. When Pitta Pradhana Avastha, any Vyadhi comes, a Jwara Pitta Pradhana, a Shirashula Pitta Pradhana, a Unmada comes Pitta Pradhana, then what you will do? Then we use Kamadvidud Mukta. Here, very interesting, there is no Parada at all in this drug. It contains Gaidika, Mukta Vishti, Pravala Vasma, Mukta Shakti Vasma, and Guduji Sattva. As you see the combination itself, you can understand. It is a beautiful Pitta Haradravya. Just when Pitta Pradhana Avastha, Pitta Jwara, Pitta Shirashula, just apply Shatadauta Gruta on the head and give Kamadvidud Mukta 1 BD. It gets relief. Within 2 hours, it is a wonderful drug. Very interesting drug. What I have seen is this drug in herpes zoster. That is a Kaksha. It's a Vata Pittaja Visarpa. In such conditions, Vata Pittaja Visarpa. Very burning severe sensation. Give Kamadvidud Mukta. If first blister starts, then the patient comes. 1 or 2 blister comes. Then itself, if you diagnose, immediately you give Kamadvidud Mukta in your clinic itself. Next blister will not develop. It will stop there itself. It's such a wonder drug. Give 2 tablets once in 3 hours. Once in 3 hours you can give. Very fast, there will be reduction. The whole blister formation, first blister comes, then itself many patient comes to you. Your primary level practice. Then slowly it spreads whole abdomen, all around. So if you give this drug in first place itself, the extension of that blister should stop there itself. Even once established disease also comes, severe burning, give Kamadvidud Mukta, you get wonderful result. Then some patient comes after they get the treatment from allopathy doctors, some other doctors, many Vaidyas treated. Patient comes in post-herpetic neuritis. They can't wear the shirt itself. If you wear the shirt, they feel severe pain. Many patients I have seen. What I did is, I gave Kamadvidud Mukta with Sutta Shekhar Rasa. Sutta Shekhar I explain next. Just 2 drugs, 1 BD you give. Within 2 days, they are burning that sensation. That is hypersensitization of the skin. It's a Pitta Pradhana. Hypersensitization. Then just give Kamadvidud Mukta with Sutta Shekhar Rasa. They get relief immediately, within 2 days. Definitely it is a wonder drug as in these conditions. Even in a Jirana Jwara also, you can utilize it. And some patient comes with the Brahma. Then also you can utilize this drug Kamadvidud Mukta. Some patient comes with the Unmada, with the severe redness, all this, and they come, they don't get sleep like that. Give Kamadvidud Mukta with Shatadauta Gruta for head. They get very good sleep, very fine result. So whenever Pitta Pradhana, only Pitta or Vata Pittaja, utilize the Kamadvidud Mukta. Then another drug is Sutta Shekhara Rasa. I tell Sutta Shekhara and Kamadvidud Mukta together. You see, very funny thing. But these drugs all you see, it's all Deepana Pachana Dravyas. You can't see it's a Ushna Virya Dravyas. How it becomes Pittahara? This question arises. Very interesting. You see, Amla Pitta, Chardi, Shula, Gulma, Kasa, Sangrahi, Daha, Tridoshaja, Atisara, Mandagni, Tikka, Udavarta, Jwara, Kshaya. These are many conditions he has told. This Sudashekar Rasa comes in, one is with the Swarna Basma comes, another drug comes without Swarna Basma, Sudashekar comes. With the Swarna Basma, the drug is very cost. Its cost over 125 mg costs around 65 rupees. Whereas without Swarna Basma, it costs about 1 rupee or 2 rupees. Without Swarna Basma also works excellently. Some companies make this Sutashekar Rasa with the Swarna Makshika Basma instead of Swarna Basma. That also works wonderfully. It's a wonder drug. I think every other patient of my prescription has a Sutashekara or Agni-Dundi. So its combination is very good. Parada Gandhaka Tankana Vatsanaba. Madura Vipaka Madurasa Ushnavirya Dravya. And Shunti Maricha Pipare Ushnavirya Dravya. Twak Patra Nakesa Sawala Ushnavirya Dravya. Dattura Ushnavirya Dravya. How it becomes Dahara? This question arises. You may ask how it becomes Dahara. Here, Daha may be Nirama Daha or Sama Daha. So Pitta with the Sama Pitta is there, then utilize Sutashekar Rasa. If it is Nirama Pitta, utilize Kamadvaita Mukta. If you have confusion, you can use both Sutashekar and Kamadvaita Mukta together. It is a wonder drug. That is why he says Amla Pitta. Pitta gets Amlata when it is a Sama. If it is Tiktata, that is a Nirama Pitta. Sama Pitta, Nirama Pitta. So you can utilize when Amlata occurs for a Pitta, it is a Sama. Agni-Mandya is there, then Amla Pitta becomes Amlata. Then you utilize Sutashekara Rasa. So in the Chardi, Shula, Gulma, anyhow, Shula, Gulma is a Vata Pitta conditions. If more of Kapha Pitta, you go for Arogyavardhini. More of Vata Pitta, go for Sutashekar Rasa. This difference, I think you should understand. With the Pitta, if Kapha more is there, go for Arogyavardhini. So that is why Sarogyana we utilize when Koshta Shaka Shita Kamala also. In the Kamala, one is Koshta Shita, one is Shaka Shita, another is Koshta Shaka Shita. In such a condition, it's a Koshta Shaka Shita. Only Shaka Shita is Kapha Avarana is there. Only Koshta is Bahu Pitta Kamala. Then you can utilize Sutashekara and Kamala. When Koshta Shaka Shita is there, another type. Because of Amayukta Pitta, there will be Avarodha is there. That is why Kamala occurs. Then utilize Arogyavardhini Rasa. Specifically, this viral hepatitis, what comes to us. Viral hepatitis. Due to that virus infection, there is inflammation. There will be blockage of the bile juice. So that if you test the liver function tests, their direct bilirubin is more than indirect bilirubin. Such condition you use Arogyavardhini Rasa. If indirect bilirubin high, but direct bilirubin less, that is purely Koshta Shita Bahupitta Kamala, then you can use Sutashekar or Kamadvaita Mukta, because Arogyavardhini may not help. In Bahupitta Kamala, usually they end up with Rakta Pitta. If you use Arogyavardhini continuously, patient may end up with Rakta Pitta, bleeding may occur. So that is why even though I am sitting in front of Susha, I am telling you about Arogyavardhini, because it is interconnected, these two drugs. When Vata Pitta is there, Sutashekara. When Vata Kapha, Kapha Pitta, utilize Arogyavardhini. So same disease, which dosha I am saying, same disease with which dosha, accordingly your drug will change. So you should not think for a Vyadhi we are giving a drug. In a Vyadhi, which dosha involved, like that drug will change. Because it's a combination almost same with the different some anubhana changes, like that it works according to doshas. Any Vyadhi with the Vata Pitta involvement, always utilize Sushekara. So it may be Shirashula, it may be Jwara, it may be Kasa Shwas. You see, Kasa Shwas, he has told. Many patient comes, what I have seen, some patient comes, they from babies or 7 year adolescent age or elder person, they go to modern hospitals, they take treatment for bronchitis and they give antibiotics, or viral fever, they give antibiotics and heavy dosage are different. What we are saying modern drug means it is Vidahi Dravyas. This Vidahi Dravyas, if you give naturally in body, Pitta will increase. A Pitta Samsargaja Kasa will occur. In such conditions, utilize Sutta Shekhar Rasa or Kamadoik Mukta. If you utilize this Nilagiri or Sapudina included many syrup comes, cough syrup, instead of decreasing, his cough will increase. Don't use such drugs. When a patient comes after treatment with the modern way, they come to us with dry cough. After much coughing, slight sputum comes. Always utilize Sutta Shekhar and Kamadoik Mukta. I think some of you people, practitioners, you may have such experience. After giving your cough syrups also, his condition will not improve. Such condition utilize Sutta Shekhar or Kamadoik Mukta. But when Kapha Pradhana Vata Kapha, then utilize Arogyavardhini, these drugs, Dashamularishta, like that. But in these conditions, don't use. You can use Sutta Shekhar, Kamadoik Mukta with the Draksharishta or Drakshari Kashaya. His cough comes down within a day. I have seen plenty of patients. Within 24 hours, they get relief. It's a wonder drug, Sutta Shekhar Rasa. Some other disease, Shula, patient comes with severe gastritis with the Shula, abdominal pain. Use Sutta Shekhar Rasa. You get result. These are some of the conditions where I utilize this Sutta Shekhar. One is another one is Shirashula. A migraine patient comes to you. So migraine patient, usually migraine means his disease, he may presenting with headache, but actually his disease is in the stomach, not in head. Usually in the stomach. With the severe gastritis symptoms, just you give Sutta Shekhar with Hingoashtaka pills. So you will get such a result when you give Sutta Shekhar Rasa and Hingoashtaka pills. Just Shirashula comes down. The drug of choice for migraine headache, I am saying. Shirashula means many Shirashula. Just I am saying migraine headache means everyone increase. When Ardha Vedaka, you may call some fellow calls in other name. And migraine headache. Give Sutta Shekhar Rasa with Hingoashtaka. Give Godanti and Narikela Lavana. Godanti Basma and Narikela Lavana. That gives wonderful result. His headache comes down immediately. This is what result we get with the Sutta Shekhar, because it has a Brangaraya Swarasaya Bhavana. In any Yakrat conditions or a Koshtaja conditions, this Sutta Shekhar works wonderfully. It's a Brangaraja Rasa is very good Anuromana. That is why it is useful in Shwasa and Kasa also. So with this, I think Sutta Shekhar is another drug. Another drug what I left is Lagu Sutta Shekhara, what is Lagu Sutta Shekhar Rasa. It's a very simple drug with the Gairika, with the Shunti, Churna and Nagavali Swarasa Bhavan. It is one of the very wonder drug in conditions, skin conditions. Which condition? Many patient comes to us with the allergic urticaria, Shita Pitta. Usually we call as Shita Pitta. There will urticaria rash all over body. Simply you give Lagu Sutta Shekhar Rasa with the Sarivadhyasva. For application, what I give is narikela taila with karpura. 100 ml narikela taila, 50 grams karpura, you mix it, make it ointment. Wherever urticaria, just you apply it immediately. Within 5 minutes, everything goes. But for his Rakta Shuddhi, Pittahara Shuddhi, you have to give Lagu Sutra Shekhar Rasa because it's a Shita Pitta. Shita Pitta. Don't think it is only Kevala Pitta. Shita Pitta means Vatas Shita with the Pitta is included. That is why it comes off and goes off faster. This Vata Samsargaja Pitta. It is not Kapha Samsargaja Pitta. It is a Vata Samsargaja Pitta. But Jali Amsha of Pitta is more. That is why he gets itching. In such conditions, why I am saying it is Vata, it's a Vishama Vega. Sometimes it comes, immediately it goes off. Vishama Vega is there. Usually think Kandu means it is a Kapha. Actually, it's a Vata Pitta condition. Just to give Gairika Shuddhi with the Nagavaleswara Sabhavana, Krishnaviri Dravya. Lagu Shekhara Rasa, it works wonderfully. Not only in other Pittaja, Shirashula, Nidranasha, many other conditions are there. In all these conditions, we can utilize this drug. Another condition is told is Rakta Pitta. Specifically, when a dengue patient gets a platelet coming down, naturally it ends up with the Rakta Pitta. In such condition, if you give Lagu Shekhar Rasa, you can increase the platelet count in the body. This is like that also it can be utilized, or you can utilize only Gairika also, so that your platelet count will increase in the body. So another drug is Gandhaka Rasayana. As a surgeon, I am practicing it. I utilize this drug extensively in my practice. It's a very simple drug. Gandhaka is a basic drug. There are 8 bhavanas. Godugda, Chaturjataka, Godujurasa, Ritaki, that is Trifala, Brangaraja, and Adraka Surasa. This bhavana is done. It is used as a rasayana, number 1. And it is used as a dravya, as a amapachaka. Both way it can be used. So it is a rasayana and Viryavardhaka, Kanduhara, Kushtagna, Visha Dosha Hara, Atisara. Visha Dosha, how Visha occurs? Don't think only this Visha. Even if an infection occurs, that also produces Visha. In these conditions, definitely you can utilize Prameha, Vata Vyadhi, Prajakara, Kesha, Krishnakara, because of Brangaraja Rasa Bhavana is that is why I am saying. Gandhaka is a wonderful drug. It is a analomaka. Gandhaka itself is a analomaka in the body. So whenever post-operative cases, whenever there is chances of infection, we utilize this Gandhaka in our practice. Not only that, if a patient comes with hemorrhoids, comes with the fissure in anum, always I utilize Gandhaka Rasayana with Trifala Gugulu. I think all of you can utilize any bottom case, anorectal cases, just use Gandhaka Rasayana Trifala Gugulu. You get excellent result. You do specific diagnosis and give other drugs. The basic drugs is Gandhaka Rasayana and Trifala Gugulu. Gandhaka Rasayana itself is wonderful. It contains Trifala also in this one, in a combination. As a bhavana is there. Many of my friends from Ayurveda, they use, some patient comes with sulfur allergy, can we use Gandhaka? For your kind information, this Ayurveda Gandhaka, after Godigda, Dugda Bhavana you give, there is no chance of any sulfur allergy in these patients. You can utilize it for any length of time. Some persons ask it should be given only 48 days or 50 days, no, not more than that should not be. It is not like that. More time also, 6 months, 1 year also you can use as a rasayana. In a small dosage you can utilize it. Usually I utilize 1 BD, about 500 mg per day. you can use 2 TAD, up to 2 TAD. That is about 3 grams also you can utilize it as need of the patient and condition of the patient, avastha of the patient. Dosage you can vary. This Gandhak Rasayan with the Triphala Gugulu, we utilize in Shwasa cases also, Khasa cases, Shirashula, sinusitis it comes. Then we utilize it. And with the Triphala Gugulu, we utilize Lagu Shekar what I heard. When there is a rhinitis, allergic nose condition is there, give Triphala Gugulu or Gandhakran Triphala Gugulu with Lagu Shekara as a mixture. Immediately his allergic rhinitis comes down. A chronic nasal allergy patient comes. So allergy can occur Pranavasrotas or Rasavasrotas in the body. Because Mula is Hridaya only. Rasavasrotas Mula also Hridaya, Pranavasrotas Mula also Hridaya. But it may express as a skin condition or it may express as a Pranavasrotas condition. Pratishyaya or Shwasa, Tamaka Shwasa, or Articularious or Vicharchika. Like that also patient may present. It goes in DNA from generation also. If father has Shwasa, son may have Vicharchika. It's the same condition, different expressions. Utilize Lagu Shekar Rasa with the Gandhak Rasayan and Triphala Gugulu. Continuously if you give this condition you can cure. If in initial stage you can cure it. So that is another wonder drug. What I use is Makaradhvajavati. It is a Swarnayukta, slightly costly, but it is a wonderful drug. Whenever there is a infections, bronchitis or small babies comes with bronchitis, repeated infections. You see, small babies comes to our clinic. I think if you are practicing pediatric cases, what they present, if they go to, they get cough fever, they go to pediatrician, they give an antibiotic on this one. Next time they come with the only breathlessness. If you give treatment with the antibiotic and this Nebdo, all these things, they comes down. Next time they come with the fever, or next day come with the Atisara. The small babies comes with these 3 conditions. One is Jwara, and then Atisara, and then is Shwasa. Repeatedly they come. In such cases, just you give Makaradhvajavati. Continuously, Makaradhvajavati. That repeated occurring, because it is a wonderful rasayana. The repetition of the disease will be stopped. In acute state, you can, if you want, you can give antibiotic, all these things. For small babies, you can't wait. Patient may suffer a lot. Once that acute phase goes off, in the chronic phase, they come, so before getting the disease, give him this Makaradhvajavati continuously. The repetition of that disease, either Jwara presentation or Khasa Shwasa presentation or Atisara presentation, that will stop. Just you give, it's a wonderful Rasayana Dravya. That he says Kalitya, Palitya, Agnidipana, Medhayu, Karadiya, Kamakdipana, and Visha, Vikara, Nashanajya, Jara, Marana. There are many conditions that they have told. As a Rasayana, you can utilize this drug. Its cost, one tablet is 20 rupees. But that one tablet in small babies you can give for 1 week. Or you can give 2 tablets for 1 week. Don't give daily one tablet. Just half gram means 2 tablets, sufficient for a week. For slightly older patients, you give 1 gram per week. 1 gram is 4 tablets. That costs about 80 to 100 rupees. But it is a wonderful drug. I utilize extensively in my practice. Even some patient comes with hypotension. Some patient may come with to you low BP patient. Give Makaradhvajavati. His BP becomes all right. Give Makaradhvajavati with the Ashwagandha Churna. So BP becomes normal within 3 days, within 3 days, his BP becomes normal. Some patient comes 90 by 60, 80 by 60 with the giddiness. Some patient comes to our clinic, and what to do? There is no treatment. In Western medicine, there is no treatment. Just to give Makaradhwajavati or Rasasindura with the Ashwagandha Churna and Pravala Bhasma. Mix it and give half of teaspoon daily. His BP becomes normal within 3 days. It goes up to 100 by 60, 100 by 70. You will be happy. For about 15 to 1 month you give. For very long of time he become all right. It's a wonderful drug. In a patient comes with the shock, with the BP coming down. Give Makaradhwajavati with the honey, just keep in his tongue. His BP becomes normal. So it's in a shock cases because what does this Makaradhwajavati? It increases flow of the blood in the artery. That's Rasavasrotas flow becomes increased with Makaradhwajavati. That is why it is a Kamoddipana is told. When the Dvajabhanga, loss of libido is there, all of you know in modern times, because of arterial obstruction, usual loss of libido occurs. So in old age or in diabetic patients or older patients, just to give Makaradhwajavati, it increases blood flow in the artery. When a patient comes with Burgess disease, give Makaradhwajavati, his blood flow increases. In a stroke patient, there is a arterial block, give Makaradhwajavati, it increases blood flow. Wherever arterial block is, Rasavasrotorodha Vyadhis, Srotorodha, Khalitya, Pandu, these are diseases he has told it, no? In Atreya Bhadrakapyadhyaya of Charaka. And that is, he says, Khalitya, Kamoddipana, these are the conditions. Wherever there's a decrease of blood flow, it will increase. In the Burgess disease, in the stroke, in many conditions, when heart conditions, where is the blood supply less, you utilize it, definitely increases. But in the hypertension patients, you should be slightly careful because it should be given along with the Kamadvid Mukta. Kamadvid Mukta. Just you should think we should use it or not, along with some Shitala Dravyas you give. If it is some other conditions, give some other, it's a combination. According to which Anapana you give, like that it works. It's a wonderful drug, Makaradhwajavati. Which Anapana you give, like that it works. So it's a Rasasindura is a Paradavasma, like that you can utilize it. Then comes Tapya Diloha. It is there are many drugs are there. It's very important. It has more of Rasaushadis than Kastavashadis. So another wonder drug. It says Swarna Makshika Bhasma, Rajata Bhasma, Ro Bhasma, Mandura Bhasma. These Bhasmas are more, 10 parts, whereas this is only one drug where Kastavashadi is less, Rasaushadi is more. Whenever there is a Pandu, Rudroga, all these things, when in some conditions, wherever you need Raupya Bhasma, I utilize this drug Tapya Diloha extensively in my practice. So Raupya Swarna Makshika Bhasma is there. If patient comes with creamy conditions, as a creamy, you can utilize it. As a Kotahara, you can utilize it. As a Pandu, you can utilize it. Whenever there is a Runashota is there, you can utilize it, this drug. If it's Amla Pitta, you can utilize it. If Ajirana is, you can utilize it. So Shirashula, you can utilize it. In a Pakshagata, you can utilize this drug. And in a Manodosha, then also it can utilize it. Wherever Raupya was needed, where and Tamra Swarnamakshika together needed, you always utilize Tapya Diloha. I am utilizing it extensively in my practice. Vasanta Kusumakara, it's a very costly drug, but in a Pramehi or Madhumehi, or coming with the diabetic gangrene, I utilize this Vasanta Kusumakara Rasa extensively in my practice. As a Madhumeha Dravya, I don't use it, but if Madhumeha complications, Madhumeha Pidakas, if a patient comes, utilize this Vasanta Kusumakara Rasa. or neuropathy is there from Madhumeha. There will be Staimitya or Sparsha or Sparsha Asahishnuta or numbness or burning, that such condition, Daha, such complications are there. Utilize Vasadha Kusumakara Rasa. Any dosha you can utilize it. Just you give some anapana changes. So more Pittahara needed, you give Sarivadya, so like that. Or more of Kaphahara needed, Katu Tikta Rasadravya, Panchatikta Kashaya, like that. You can utilize it according to its anupana. Or you can have mixed combination. Asanadi Gana is there, and with the Panchatikta, like that, mix and give according to your presentation of the patient. A Vyadhi with different, same Vyadhi, different presentation, different combination you can make and give in your practice. Another Vata Kaphahara Dravya is Vata Gajankusha Rasa, which contains Trifala, Trikatu Agnimanta and Mundi and Nirgundi Rasa Bhavana. It is a wonderful drug in Amavata, what I utilize in many of the patients, specifically utilize in Amavata and Vatarakta cases. Whenever Vata Kapha is involved, Pitta involved, I don't use it. Whenever Vata Kapha is in there, this drug is being used. Then coming to some Gugulu, it's the last presentation. Gugulus, as a Gugulu, there are many Gugulus there. I think I have seen many Gugulus. All Gugulu, you see, whatever Gugulu you take, these Gugulus, every Gugulu has Trifala. See, it has Trifala, Gugulu Trifala, Kaihara Gugulu has Trifala, Kayukshara Gugulu has Trifala, Yogara Gugulu has Trifala, Kanchana Gugulu has Trifala, Simara Gugulu has Trifala. Why Trifala is there in all the Gugulus? See, Trifala is best Deepana Pachana Dravya. Wherever Rakta Dushti is there, Raktavana Vata is there, as an Amapachana and Deepana Dravya, all the doshas are comes with Ama only. By default, it will say with Ama. So this Amapachana is Vata Sarupa Amapachana, Pitta Sarupa Amapachana, you should think. If you see this Trifala Gugulu, it is Trifala with the Pippali and Gugulu. It's the best Vata Sarupa Amapachaka. Whereas when the Pitta Sarupa Ama, you use Kaishara Gugulu, it comes with the Guduchi. If Pitta Jali Amsha more, go for Gokshari Gugulu. Agni Amsha more, go for Kaishara Gugulu. Jali Amsha, you go for Gokshari Gugulu. It is a Kapha Sarupama, go for Goyagraja. It contains more of Chitraka and all Katu Ushna Vidya Dravyas with the Trifala. So you utilize Vata Kapha, go for Yogaraja. Vata Pitta, go for Gokshradi Gugulu or Kaishara Gugulu. Kevala Vata, go for Trifala Gugulu. So if it is Kaphas Jaliya Parthivam Shamor, go for Kanchana Gugulu. It contains Trifala with the Kanchana. Katinyata more. Jaliyam Shamor of Kapha, go for Yogaraja. Then coming to, if it is a Dhatukshaya Vata Ruddhi, then go for Trayadasham. It is only Gugulu, does not contain Trifala here. See, Babula, Shoganda, Guduchi, Shatavari, Gokshura, Vrudadaru, Rasna, all Vatahara Dravyas mixed with 50% of Grita. See, 12 equal to 50% Grita. Equal amount of Gugulu, 50% Grita is, as a Grita Paka is done, when your Dhatukshaya Vatarudhi or Avarana Dhatukshaya state is there, it plays Trayadashana Gugulu. This Trayadashana Gugulu comes with the Babula, another combination is there. Instead of Babula, they have utilized, used Lashuna. Can use Trayadashana Gugulu with Lashuna or Trayadashana Gugulu with Babula. Both you can use as a Brahmana Vatahara. Brahmana Vatahara. These are our Karshana Vataharas. This is a Brahmana Vatahara. That is a different is there. Sivanada Gugulu again, it is a Karshana Vatahara. It is Yeranda Taila Bhavana is there. If Vibandha is there whenever Avarana Vata, it's a Simvanada Gugulu. So with the that is how I use Gugulus in different conditions according to presentation. Same Vyadhi, presentation of different dosha you see, different Gugulus I utilize in my practice. Where that is why He said Gugulu should be used in Madhyama Roga Marga, Kati Asti, Snayu, Sandhi, Data Vyajis. Wherever it or in Ranashota, all these things, various we have to use Gugulus. But according to presentation of doshas in different Vyadis, you select a particular Gugulu. With this presentation, always it is always learning process whole life. That is why Sushruta says Satata Adhyayana, Vadaha, always discussion. I think discussion is very important. There may be many questions, I don't know. And Paratantra Avalokana and Tadvidya Achara Seva. If you work with any Acharya, get first-hand information, a practical understanding of the theory. What I ever said now, it may be there with you for 24 or 48 hours. But if you work along with any Acharya, you can understand Taratama Bhava Veda of the doshas, which Gugulu in which stage, where we have to use, or which Rasaushadi. There is nothing like a single drug for single disease. No. For single disease, with the different dosha, there will be different drugs are there. I hope it is a treating physician's prerogative which drug he should select. According to presentation of dosha, he should select. Now I have discussed according to dosha, different dravyas, what I am practicing. So you can't write it for the Jwara, I am giving this drug, for Atisara this drug, for skin disease this drug. Like that you can't write. Same drug I can utilize in all the diseases, but according to that particular presentation or avastha. That is why Charaka says avastha avasham chikitsa kutya. Even in the Rasavashadis also, just like Ashtavashadi, you have to see doshas in the given vyadhi, then we have to treat. So with the presentation, I conclude my presentation. Thank you very much. If you have any questions, you can ask. Hello?
Participants can ask your questions.
Yes.
Sir, shall I ask one question, sir?
Definitely.
Sir, in case of COVID, has any of these helped in any condition, sir?
Which one?
COVID.
COVID conditions.
Yes.
COVID conditions, you see, Mrutyunjaya Rasa and Arogyavardhini is a drug of choice.
Okay.
Whenever Vata Kapha is involved or Kapha Sthana is involved, especially it is a arterial blood clotting occurs. Always it's a Rasasthana. You give Arogyavardhini Mrutyunjaya Rasa along with Amritarishta. It works wonderfully. In the first day you give, the second day it will not increase. Your disease will come down.
Okay, sir. Thank you very much.
Yeah.
Participants can either raise their hands or you can write in the chat box.
Yeah.
Sir, there's one question, sir.
Yes.
In hypersensitivity, how will be the dosage of Sutta Shekhar Rasa and for how long is it given?
Hypersensitivity of what?
Participant can kindly unmute and ask your question.
Hypersensitivity of what?
Namaste, sir.
Namaste.
Sir, in the right shoulder joint, the patient complaining of hypersensitivity. Sir told even he can't put the shirt like that.
Yeah. I understood your question. Hyper. What I said. There will be severe irritation, especially it is in the skin condition. Herpes zoster I have sold. In such conditions, Sushekara with the Kamadud Mukta should be given. For 15 days, you give sufficient. They get result.
Okay, sir. Thank you.
It is not for joint disorders, only skin condition.
Yes, sir. I thought for joint disorders also.
No.
Okay, sir. Thank you.
Yeah. Okay. Thank you.
Any more questions? So there's another question, sir.
Yeah.
Post-herpes pain experience, please, sir.
That was what I have told already. I get many patients with the post-herpetic neuritis, with the severe pain or hypersensitivity. They could not wear the shirt also. Or during herpes period also, there will be severe pain and hypersensation. I usually give Sushekara and Kamadud Mukta for application when disease is there. What I give is a Shitaladhara, Himadhara on that area. An application of Rasnani Churna with the Tandulodaka. And Sushekara and Kamadud Mukta continuously give. When disease is there, when the skin condition completely healed, only hypersensitivity, no need of application, give Sushekara and Kamadud Mukta. When the disease is there, skin condition is there, give Rasnani Churna with the Tandulodaka for application. And if burning is very severe, go for Himadhara to that area. If needed, some patients I do Jalavakavacharana also. So in some patients very severe disease there, ama condition is there, go for him Koshta Shuddhi by Sadyomara and Satyavirechana. These things I do in my practice. They get relief within a week, almost they get relief complete. Not my experience, not one patient, there is hundreds of patients are there. So this is how they get result. Okay, I think I have answered your question.
Thank you, sir. So another question, in cancer patients and all, when they're they use morphine and all for reducing the pain. So instead of that, can we give something of our Ayurvedic Shulahara, any drugs which you have mentioned?
Cancer patients, I think as a symptomatic, our drug does not work like morphine. I think morphine itself is an Ayurveda drug. Say opium included, many drugs are there. It is now banned by government. Actually, Nidrodaya Rasa is there. It's a wonder drug of Ayurveda. Previously, it was being utilized by Ayurvedic physicians. That is a wonderful drug, Nidrodaya Rasa. You can see its comment. It contains opium as a main content. If government allowed to use this Nidrodaya Rasa instead of this modern opium, this Ayurveda opium with different drugs, It gives wonderfully pain-killing effect and gives a very good sleep without causing any constipation. This is about 20-30 years back it was available in the market. Now government has banned. I think with the permission of government, some companies can prepare this drug for especially cancer practitioners. It will be a wonderful drug. And this Agnitundi or if a neurological conditions, I think you can use Agnitundi as a pain-killing effect drug, Kostaja and some neurological conditions. If more of burning pain, such conditions are there, I utilize Husheka and Kamadud Mukta in my practice, even in cancer patients also. And Vata Kapha conditions, I utilize Vata Gajankusha Rasa, but its pain-killing effect is not that much what I feel, just like opium. I think that there is no replacement for opium. Opium is an Ayurveda drug. We in Ayurveda for centuries we are using opium as a main drug stay in Ayurveda practitioners. I don't know why government has banned by Ayurveda physicians. Maybe it's wrong usage they may have banned. I think with the permission of government, some companies can prepare this drug and give. So, okay, I have answered your question. I think so.
Yes, sir. Yes, sir.
Yes.
Yes, sir. There's one more question. Please share your experience in stopping heavy bleeding conditions.
Heavy bleeding conditions. Okay.
Yes, sir.
Okay. I think that is a. You see, bleeding itself is a Rakta Pitta. Pitta can be tackled by Madura, Tikta and Kashaya Rasa Dravyas. When severe bleeding is there, Adhogata Rakta Pitta, menorrhagia or bleeding piles or urinary bleeding, anywhere a bleeding is there. If it is a severe bleeding, then I use Kashaya Rasa Dravyas. Especially with Chandrakala Rasa is there, one very good drug. Along with that, Kashaya Rasa Dravyas like Ashoka Arista or Pancha Valkala Kashaya or Pushyanuga Churna. If it is a Kevala Pitta, if it is a Kapha Samsarga, I will understand Kapha Samsarga by Grantiva. There will be clots will be there. When with the clot bleeding is there, immediately bleeding there will be a clot. Then utilize Tikta Rasa Dravyas, Kutaja Gruta, Kutaja Ghanavati. Along with this Kamadud Mukta and Chandrakala Rasa. If it is Vata Samsarga condition, use Madhura Gana Aushadhi Dravya like Shatavari Gruta or Shatavari Kshira Kashaya. So same disease with the different presentations. You can use Madhura Gana Aushadhi Dravya when Vata Samsarga is there. Kevala Pitta Kashaya Rasa when Kapha Samsarga Tikta Rasa. Madhura Tikta Kashaya. All three Kashaya Dravyas you can utilize, but which dosha in that Vyadhi you have to see, like that you can utilize it. That is what I am utilizing. Plenty of patients you get result in all the patients. Usually I get plenty of patients of hemorrhoids and plenty of patients of menorrhagia. These two conditions I usually get in my practice, plenty of cases. Urinary bleeding very less. Still I utilize these drugs. But most of the cases I get is one is bleeding piles and one is bleeding per vagina. By seeing the doshas, I use these dravyas, what I already said. I think I have answered your question. Hello?
Yes, sir.
Yes.
Yes, sir. Yes, sir.
Yes.
Sir, one more doubt, sir. Could you share your experience in stroke?
Yeah. Stroke, yeah. It is a disease explanation, but I think I should have a whole presentation differently. Anyhow, plenty of stroke patients I get acute strokes. When it is infarctive stroke, I utilize this Arogyavardhini that I have shown here, you see. Arogyavardhini with Mrityunjaya Rasa and Kamadad Mukta. When it is hemorrhagic stroke, I use Kamadad Mukta with the Mahatikta Grita and Yashti Kshira Nasya and Himadhara. So, Vata will be there. Is it Kapha Pradhana or Pitta Pradhana use? Usually, hemorrhagic stroke comes with the Pitta Pradhana and infarctive stroke comes with the Kapha Pradhana. Like that, differently, I utilize many drugs. First, we give Himadhara and Nasya. After Nasya, we give Virechana, Mrudu Virechana. Then go for Basti Karmas, Mahamanistari Kashaya and Tulasendavai Taila. If it is Pitta Pradhana, Mahamanisha Kshira Kashaya Basti and Kshira Bala Taila for Anuvasana Basti. Dhara is Himadhara, Nasya is Yashti Kshira. Whereas in Kapha Pradhana, utilize Yashti Viparachamari Singha Saindava Kshira as a Nasya or Shwasakutara as a Nasya. The Grita is used Phala Panchagavya Grita or Kalyana Grita when Kapha Pradhana or when it is a Pitta Pradhana, Mahatikta Grita. It contains mainly Amalaki Swarasa. That is why we utilize. And in Rasavashadis, Kamadad Mukta, Arogyavardhini, Agnitundi, Chandraprabha, Swarna Sutashekara. When the Pitta Pradhana go for Sutashekara, the Kapha Pradhana go for Arogyavardhini. Like that we utilize. And Rasavashadi and Gritas and Kashayas, Arishtas should be used according to presentation of the dosha. So without seeing the dosha, we can't practice Rasa practice or any Ayurveda practice. I hope I have answered your question.
Yes, sure, sir. Thank you very much, sir.
Yes, thank you.
Participants, if you don't have any more doubts, shall we conclude this session? Sir, shall we conclude the session? Shall I call for vote of thanks?
Okay, madam. Thank you.
I now invite Dr. Anjali Warrior for vote of thanks.
Hello. Can you hear me?
Yes.
Okay. Good evening, everyone. Honorable Chief Guest Dr. Ravishankar Pavaji sir, respected Dr. Sini ma'am, Vanida Committee Chairperson Malappuram, and all the participants. It is such an honor for me to get the opportunity to thank you all dignitaries on behalf of AMI Malappuram Committee. I extend my gratitude to our Honorable Chief Guest, Dr. Ravishankar sir, to take out time from his busy schedule for this valuable session. Thank you, sir, for inspiring and encouraging us by sharing your wonderful clinical experiences. A special thanks to Dr. Sini ma'am and Dr. Mithun for providing immense support to make this webinar successful. I congratulate all the participants for their active participation. Thank you, everyone. Thanks a lot.
Thank you, sir. Thank you, Anjali. Sir, shall we conclude, sir?
Definitely. Okay. Thank you very much.
It was a very excellent session, sir. Thank you very much.
Thank you.